All right, and we should be live. Hi, everyone, and welcome back to another session with Dental Shadowers. Today, we're joined by Dr. Shapiro, who will be talking about orthodontics. Doctor, thanks so much for taking the time to connect with us. Please feel free to take it away whenever you're ready.
Awesome. Thank you. How's everyone doing? I have like the live stream going right now, but maybe it's not working on mine. I don't know. It says live stream offline.
I think it'll take it a few seconds to start up.
There's a lag. Yeah, there's like
there's a lag.
30-second lag.
So yeah, my name's Luke Shapiro. I'm an orthodontist. I graduated last year from residency and in 2018 from dental school. So like a little bit about my journey. I'm from New York. I went to college for 4 years at WashU St. Louis. And then I went to Stony Brook for 4 years, and then I went to Tufts for 2 years for ortho, and now I'm back in New York. Dentistry's always been like kind of in the back of my mind. My dad's a dentist. I'm sure like many other dental students out there. I actually wanted to be a doctor, like a physician at first, but I shadowed a lot of physicians and they were like, don't do this. There's just like too much insurance and politics. And so I decided on dental. So this met me and my dad at my graduation. He actually like hooded me. So that's a cool thing. You can have a family member hood you. And then this is at the retainer. It's on the High Line in New York. I don't know if anyone's seen it or not, but it's really cool. I highly suggest you go. And just like a little fun story about this. So a friend sent me a picture of the retainer and I was like, this is insane. Like this is a huge retainer. So I showed it to my colleague and he was like, I think that's our retainer. And I'm like, what are you talking about? And we actually have like a specific design that we use, this like little clasp right here that the guy invented like 15 years ago. And then we looked up the artist and she actually is one of our patients. So she had actually been to the office a couple years ago, got a bunch of retainers. She made that out of marble and then it has to be moved around by a crane. So she moved it, she like brought it there. And so that's like our office's retainer. So
your office was the inspiration, the
muse. Exactly. Here, I'll try the comment box now. I'm actually curious like where everyone is from. So if you want to like put down where you are in the world, that'd be cool. All right. So what is orthodontics? I'm sure many of you know, but basically we straighten teeth, we align jaws and teeth. And now recently, they've been trying to expand into other parts of your oral health and well-being and airway. There's a little bit of controversy around all that, but there's a lot that goes into straightening teeth. Basically, you know, you have all these different forces that are kind of determining where your teeth are and how to keep them straight. So if you have like a tongue thrust, it'll make your teeth be different. If you're grinding your teeth pattern, your teeth will be different. And then there's retention. Everyone always comes into the office now and says that they didn't know they had to wear a retainer. And you actually always have to wear a retainer. I still have my permanent retainer. It's been in there for like 15 plus years. Oh, this is cool. I can like see everyone now. We got Chicago, Miami, Indiana, Ohio, Southern California. Very cool. So the lag time I think is about like 2 minutes. Anyways, so some advice for pre-dentals. I'm also curious, you can let me know like what year you're in, or like how old are you, I guess, or if you're in high school or college, because I feel like that also will depend on the advice I give you. For example, if you're in a dental lab, you can pretty much work there at any age. I highly recommend that. If you can find a dental lab that will let you. Some dental labs might not pay you because you might not really be able to help, but I think it's really cool just to be in there and kind of, you know, get your hands wet. If you are shadowing at a dental office, you're not really going to be able to touch anything. You can look. And for me, that got really boring. Dentistry is not boring. It's just like you're so far away from the patients, and it's hard to interact. There's a lot of cool dental camps too, and impression days. I went to Stony Brook. We had one there. There's a bunch of them. You guys, I don't know, you guys can write them in the comments so other people can know. But it's like a couple days, week-long thing. I was like one of the camp counselors one year. It was fun. We had a good time. Research doesn't even need to be dental related per se. I think it's good just to understand like the whole research methodology and process and whatnot. Like in 8th grade, my research project was on Crest white strips and whitening toothpaste, and I just like basically did testing on my faculty and friends, and you understand like the scientific process. It wasn't nitty-gritty science, but it's a cool way to do things. Volunteer work. Most people are in the profession to help people make their lives better. So even if it's not dental related, I think it's a good thing to do, and it's rewarding. Learning a language. I was a Spanish major in college. I definitely recommend learning Spanish. Most people will have at least one patient in dental school that only speaks Spanish or prefers to speak Spanish. In Tufts, we had a lot of Chinese patients. We were in Chinatown. I took like a semester of Chinese. I can't say much, but I could say like, my name is, how are you? And when they heard me say that, like they flipped out and they loved it. So it's like a really great way to connect with your patients. Hobbies. I think some of the schools ask you like what type of hobby you do. I wrote down like I play the trumpet. I don't know. I don't think that was a great answer. But definitely the more artistic kids, they excelled in certain parts of dental school that took me a little while. In like wax ups, when you actually like make teeth out of wax, that's one of the first things that you do in dental school, and the artistic kids really stand out there. Then the last thing is finances. I think even if you don't want to be a dentist, like just understand taxes and loans and basic things that they don't teach you in school, and I don't know why. Investing, I don't know, just put like a little bit of money in the market or in crypto or whatever, but just like understand like how money works, and it's a good skill to have. All right. What do patients come to me with? A lot of patients will say, you know, they want to fix that keratoid tooth there, they can't bite down well. A lot of patients don't come because they want to have braces. Their general dentist will send them because they need implants or crowns or whatnot. So there's a bunch of reasons why people come. A lot of kids also come, like their pediatric dentist will say, oh, we saw this on an x-ray, or like this tooth looks like this. So yeah. A lot of the kids too, they don't care about their teeth. Like they think their teeth look fine, and the parents, you know, say, my kid has crooked teeth. What do we do? Basically braces and Invisalign all day long, or clear liners, I should say. Retention checks, wire changes, whatnot. All right, typical day. So I start the day like around 8, 9 a.m. The other dentist in the office, I think he comes in at like 6 a.m. We see patients from 9 to 1, and then we have a lunch break of 1 to 2. Sometimes we'll do some clin checks and consults during then. And then 2 to 6, we see patients. And then after work, the work stops, but you always have like CE or networking events or study clubs. I'll just give like a shout out now to Ignite DVS. I'm in a online Zoom study club, meets once a month, and I definitely recommend doing the study club. It's a good way to kind of stay on top of like what's going on. There's like some really good Facebook groups I like, that, you know, you get like little tidbits and tricks from people. Okay, diagnostic instruments used. In ortho, we use a lot of the scanners. We personally have an iTero scanner, the newest model. It's called the 5D or the 5D Plus. You can get a lot of information from it. You can learn about occlusion. They have this new thing called NERI technology, so you can do a kind of basic diagnostic exam for cavities. It looks like this, and it shows up a little bit more white if you have a cavity. We also use CBCT. We have the ProFace here, so it takes a CBCT image, which is a 3D X-ray image, and then you can also onlay it with a face, with a 3D picture, so you can like see everything. And then we also use lasers. We use lasers for TMJ pain. We use lasers for gingivectomies, contouring, lots of cool stuff. This one, I'm giving a shout out as well. This is called the Smart Mirror. I think this is gonna like revolutionize dentistry. It's a really small mirror, basically the size of a normal dental mirror, and you can get really nice high quality images. You can take pictures that you could then send to the patient's chart. So say you're doing an exam and you see a cavity on someone, you can take a picture of the cavity. You can take a picture while you're doing caries excavation. You can take a picture of someone's bracket. It's really, really nice. You can also auto dictate. So you can say, you know, patient has a cavity on this tooth, so you don't have to type it in. So yeah, definitely be on the lookout for this. This is a very brand new product. I think it's really only in beta testing, but it's revolutionary. So I'll go over a couple cases, kind of just to show you what I'm looking at on a day-to-day basis. So this is, we call this an underbite. Basically, the top teeth are behind the bottom teeth. We have some crowding here on the top and the bottom. One thing I always look at, I look to see like the arches. This is kind of like a narrow arch. Usually you want more like of a broader arc shape. And on the lower, you can kind of see like the teeth are tipping in. It's better when they're upright. And then, yeah. In ortho, we always like are talking about occlusion. Occlusion is the way teeth come together. So in his case, we call this a class 3. Basically, the canine is way farther back than the bottom canine. I apologize, I'm like talking too dental, but let me know if I am. So for this patient here, a lot of people like would say, wow, like this is crazy. This is like a surgery case. But you always got to think, you know, this is just a picture, right? In person, you know, I think down the line, we'll have more videos and whatnot. So this person like could easily just be going like this and just sticking their jaw forward. And then, you know, when they put their jaw back, you're like, oh, wow, this isn't a surgery case. So for this patient here, he couldn't get his top teeth to come over his front teeth, but he could kind of get them like edge to edge. So we did braces for him. I use this, oops, not that. I use this technique, it's called Mew. Basically, it has like a bunch of bends between each of the teeth. It's a really cool, a little bit complicated technique, but it can help you do some more advanced movements like this. And this was about like a 20-month treatment. Yeah, in this case too, like you could have done surgery, but he really didn't want surgery. Surgery is like a big undertaking. So we tried to, you know, give him the best result without surgery. Let's see here. Yeah, pretty good. There's like a little bit of the midlines are not perfect, and you could settle a little bit better. But yeah, I'm pretty happy with it. Here, I don't know. We can try doing like the comment thing again. You can let me.
Oh my God, I didn't know you were here. I'm sorry.
Yeah, you can come in.
No.
We're just doing like a YouTube thing. Say
I'm
hi,
sorry.
Sandy.
It's just that.
Say hi.
Hi. Oh my God, you scared me. No, I scared myself. The suctions are in here, but we
All right.
don't disturb Dr. Booth.
It's all right. Sorry, they were turning off the suction. So here you can let me know, like, what are you thinking here? Like, what are some things that you would want to correct, or what kind of problems you see in this patient smile? For me, when I'm looking at teeth, we're looking at a lot of things. First off, I'm looking at the incisal edges, so you can kind of see a little bit of the incisal wear over here and over here. I'm looking at the size of the teeth. So normally the anterior teeth, there's like the golden proportions. They're normally like a little bit longer than they are wider, but these look a little bit square, the teeth. I'm also looking at how the teeth come together. So on the patient's left side, you can see a little bit of their tongue kind of sticking out, whereas on the right side, you don't. I'm also looking at the tissue, if it's like thin tissue or thick tissue. I'm looking at the width of the teeth. So if you look, the molars are like much further out than the premolars. I'm looking at the angulation of the teeth to see if they're coming in, like, or sticking out. And I'm also looking at the angulation of front and back. Another, like, a little side here. These are two pictures I took with the same camera, but different lighting. So that's why they look different. So on the left, this is a softbox, and on the right, this is with ring flash. So like on Instagram and stuff, you'll see a lot of people use a softbox because it looks really nice. It's just like you need like a very big studio type of light to get this effect. And this is just like a little light that you have. It's like a circular light that you have on the camera. So this is the same patient, just showing you a couple more things that I look at. So that you see the top teeth here. This is called retrocline, so they're kind of pushed in, and you can also see on their x-ray here, the x-ray over here, where they're kind of pushed in a little bit. Also, we're looking at the size of the teeth. Maybe the laterals are like a little bit small. And this is called the cephalogram, lateral ceph. And basically with this, we're looking at the inclination of the teeth. So if they're flared in or flared out, and we're looking at the joint, and we're looking at basically the relationship between the lower jaw, the upper jaw, and the skull base. So for her, I ruined it, sorry. I was gonna say, did I do braces or Invisalign? And I just want to make one point here that every patient basically wants Invisalign, I would say. Nobody really wants to have braces as an adult. Aesthetics and I'd pretty much say aesthetics. But there's certain movements that I really try to encourage patients to do braces. And one of them, it's called when they have like these teeth that are kind of pushed in over here at the top. So like when they're retroclined is what we say. When they need more torque. Basically, the way I would think about it is plastic is not as strong as braces. So there's certain movements with the roots that work much better and faster with braces. Can you do anything with Invisalign or clear aligners? Yes, but a lot of times the braces will be faster and more effective, and you'll get a better result. So yeah, with her, I convinced her to do braces. Another, you can kind of see here, basically, as I started straightening the teeth, the gingival levels look good, but the incisal edges didn't, and it's because she had chipped them a lot. A couple things here, like basically you got the braces. On top, you have, these are ceramic braces. So I do that a lot with adults because it's not as noticeable. And on the bottom, those are metal braces. These also here, you can see here, these are steel tied in. And on the bottom, these are tied in with, I call them O-ties. So they're kind of like mini rubber bands. Another thing too, what is it? On this side here, this is called a power chain. Basically, that helps to close the teeth, close the spaces in the teeth. So this is the before and after. This is, remember, I took this picture like with the nice studio lighting, and this is us with the twin. I'm still like working on my pictures and getting them consistent throughout. So yes, I recommend everyone like get as good as you can with pictures. Pictures are worth 1,000 words. Sometimes in dental school, I would just show a patient a picture of their teeth. I wouldn't say anything, and they'd be like, "What's that? I want to fix that. I want to fix that." So it's a really good tool to have. The better the picture, the better the patients can see, and then also you can, post them on your website or whatnot after. So even like critique myself, like here, this is like a little bit overexposed. I don't like it to be like as white, but I'm still practicing. Another thing too cool you can see here is like how the front incisors are tipped in, and then after treatment they're more tipped out. And then this is like her face, and basically I like this because you can see how it kind of brings out her smile, after the treatment. And then we did like a little bit of cosmetic bonding on the bottom. Was that it? Oh, sorry. That was really quick. One thing about that case, the way I convinced her to do the braces first, because you can always tell patients after you get those major movements that you can move into clear liners after for some minor tweaking. So that's what I had told her. So some advice to you all, I would just say there's a lot of people in your class, there's a lot of people in other professions. I remember when I graduated college, I was in dental school, and all my friends were like in finance partying, and I was a little bit jealous. So you just gotta stay focused and don't compare yourself to people, to others. Just compare yourself to the person from yesterday. You'll see a lot of stuff on social media from dentists, and you'll say, how do they do that, how do they do this? Don't believe everything you see. Just try your hardest and work hard, and I think it'll all work out. Yeah, thank you for joining me. Check out the DentalShadowers Instagram. You can follow me on Instagram. You can follow my practice on Instagram for more dental stuff. I'm still working on getting more dental stuff on my social media. I have a TikTok that's Dr. Shap. I should have added that. That's more dental ortho stuff. And yeah, that's pretty much it.
Awesome. Thank you for the. I want to thank you for the shout out, and we really appreciate your time. I guess at this point we'll go ahead and hand it off to Dia, our chat moderator, so we can answer a few questions that were submitted by the viewers in the chat. Dia, if you'd like to take it away.
Yeah, sure. Give me 1 second. Okay, so the first question we have is, can you transition from braces to Invisalign after you accomplish these movements?
Yeah. I kind of answered that before, but yes.
Oh, I'm so sorry.
No, it's okay. No
Okay,
problem.
great. The next one is going to be, did you ever get imposter syndrome after dental school?
What's that? What's imposter syndrome? Exactly.
Imposter syndrome? I think it's like, let me look it up really quick, but I think like you're not really supposed to be, wait, let me look it up. It's loosely defined as doubting your abilities and feeling like a fraud.
Oh.
Doubting your abilities, basically. Like,
yeah.
do you ever doubt yourself?
I still doubt myself. So
I think most of us do.
I mean, I think it's natural. I would say take pictures and learn from yourself, but the doubt is normal.
Yeah.
Don't worry.
All right. And then the next question is, what are some of the best and most challenging things about dentistry?
Some of the best. I really like the dental community, the effect it has on the patients. There's like a lot of great stuff, but also like the the patients are the best part, but they're also the worst part. Like managing them can sometimes be difficult. Managing staff can be difficult. I wish I could just like go into work and just like do teeth stuff all day and leave, but that's not the reality.
Yeah. And then what skills and personality traits are most needed to excel in this field?
What skills and personality traits?
Mhm.
I would say personality wise, I would say just being empathetic and calm and hardworking. You know, like you have to like keep on learning. You know, always like I would say what you learn in dental school is probably going to be obsolete after like 5-10 years. So you just got to be ready to keep learning and have an open mind. Skills wise, I don't know, maybe like it's more like maybe you're not the most artistic, but more so for me, it's having in like artistic vision and understanding what is good. You can like teach yourself. It might take you longer, but you can eventually teach yourself to be good with your hands. But you need to understand visually first.
That makes sense. And then the next question, why put metal braces at the bottom and not ceramic as well?
Great question. Ceramic braces can sometimes be abrasive to the teeth. So depending on their bite, it can start to wear away enamel. So if someone has a deep bite, we don't like to do that.
Got it. And then how do you deal with difficult patients?
It depends. Stonework was really good at, we had a lot of pediatric clinic. So those are difficult patients in that they're literally like we would have to like strap them down to a board sometimes. So they're difficult in that sense. And then you have difficult patients on the other hand that are, they say, you know, I want to straighten that tooth, I want to fix that tooth, I want to fix the color there. So just about managing expectations. Communication is key. Communication is really key. There's a good quote, good story. There's an oral surgeon that's really, really good in New York, and all his patients love him. And say, for example, he were to lose, someone was to lose like 3 teeth during a surgery, they'd say, thank God, you know, I'm with this doctor, because if not, I would have lost all my teeth. So it's just getting patients to trust you and whatnot.
And then do you have any mentors? If so, how did you meet and build your relationship with them?
My dad's definitely one of my main mentors, but so I was just born when that happened. But other people, definitely good to have mentors. I had like a lot of faculty mentors. I think just being inquisitive, ask questions, show that you are trying and learning, and basically, how can I put this? Like the people at dental school, like they're not there for the money, they're there to help you, and they really appreciate it when you are obviously trying and putting in hard work. And then, you know, you can go out to dinner with them or drinks after or play sports with them, and the relationship can grow that way. So yeah, just show that you're putting in the work to learn, and then they'll also be there to help.
And then any tips to write your personal statement?
Personal statement, that was always a tricky one. Luckily, I don't think it matters as much as getting into college. I personally like wrote about an event that happened to me. Uh, One of my friends, he like got punched in the face and his teeth got avulsed, and so I called my dad, and my dad was like, "Yeah, just like put them back in." So I just like pulled his teeth back in. Um, but it's not about the story; it's about how you tell it, your writing style, the flow. Uh, I would just say start writing, see what happens, let it sit, keep writing again. Um, but just try to draw inspiration from what you've done, and have a lot of people read it as well. Talk to your friends or family, maybe they can help you out.
Yes. And then if you could go back and do anything differently, would you? Meaning like pre-dental wise or even in dental school.
Nothing really sticks out to me. Let me think. The PAT was harder than I thought it was.
Yeah, that section is really hard.
That section's hard.
Yeah, it's not as complicated as you think, but then you start
Yeah.
doing it and it's like it's
I think
hard.
I only did like one testing thing, so do like a bunch of testing companies because they all have different questions. Um, no, I'm pretty happy, honestly. Like everything I chose, I think it's something I'll let you know.
And then what made you choose orthodontics over the other specialties?
I had a great orthodontist growing up when I worked for. So that kind of like opened the door. Honestly, you don't get that much ortho training in school. So you really have to seek out the experiences outside of school. But orthodontics, I really like that every like every patient is like happy to be there, like they want to be there. A lot of dental patients, they come to you for a cleaning and you say you have a cavity. Like no one wants to get a cavity filled, but people that get ortho want to have nicer teeth. And it's fun to interacting with all the specialties and doing all the planning and technology.
Mm-hmm. How has COVID-19 affected your practice, considering the high risk of transmission in this field?
I wouldn't say we're like that high a risk. I mean, no one in our office got COVID from a patient, and no patient got COVID from one of us. The main thing I would say is that I don't take off my mask at all at work anymore. So it was difficult to meet patients and meet parents because the parents also couldn't be in the room. So it was hard to start to establish those relationships, and we had to do FaceTime and calls and whatnot. Who knows when I'll get to take my mask off again. But that was the main thing.
Besides the, sorry, I just want to jump in.
No.
Besides the mask, do you think any other changes that were implemented amidst the outbreak will sort of prevail after
we wear scrubs
the
now,
pandemic?
and we used to wear like a suit. I really like the scrubs, so I'm hoping that one stays. Also, more people are using the shields. I think they realized now that, like, because we were wearing them, there's like a lot of saliva and water on them, so they don't want to not wear them. N95s, I think more people are wearing not the full-on one that makes you suffocate, but like KN95 or a lighter N95. That might be for a while. The temperature checks, maybe. I don't really think they do much. I mean, it's like 100 degrees right now in New York, so people are all testing like really high when they come in because they're so hot from being outside.
Yeah, same thing in Florida, South Florida. Yeah. And then next question. How did you prepare for your interviews? Or if you can remember.
My interviews, I did a couple practice ones with my dad. So you could do that with, I mean, they don't even have to be in the dental field. An interview is an interview. Everyone kind of knows that the questions they're going to ask. Why dentistry? What do you like to do? They're really basic interviews, but just practicing. I think the more you practice, then the more you have like ready to just spew out the information. And then you can probably go to like your local dental school. I'm sure they have like an interview prep day or something like that.
Perfect. And then I don't see any other questions, but John, if you have any questions.
Yeah, sure. I like to ask our guests this question because I guess the answer varies, obviously, person to person. But how was your transition from dental school and from residency to the workforce? Was it difficult to acclimate to the clinical setting? Was the timing startling, or do you have any sort of insight that you'd like to share?
I would say it's definitely a transition. I mean, it's nice going from dental school to residency, at least because like that's not as tough as a transition. I can't imagine going from dental school like right into the workforce. I mean, people do it all over the country, but I think you just learn a lot from residency. So recommend that. But I would say that the main thing is just like getting used to the different systems. Like we use different brackets and we use different wires or use different drills. So getting used to that was different. Even like little things like the gloves are different. And then also just like the patients too, like the patients at dental school will be very different from the ones in private practice. And then also just like your role, like in dental school, you don't work with an assistant, so you have to get used to working with assistants and being more of a team player than just yourself. And they're there to help you, so you really gotta trust your staff to help you.
Right. Just, I guess, a follow-up to that question. I think oftentimes a major gripe or like a major concern of recent grads is that it's very difficult to navigate, I guess, the business and managerial aspects of dentistry, of running a dental practice. Do you have any advice that you'd like to share? Because we do have, an audience of viewers who are, dental students who are recent grads, as well as, undergraduate students and high school students.
Wait, so what's the main thing?
Just learning or sort of acclimating to I guess, the business aspect of dentistry.
Yeah. The business, the main thing. I mean, you'll have like one finance class in dental school. Really, like the main thing is just like talking to mentors, talking to like other people at the practice, talking to your friends, like the Facebook groups. Shout
out to Dr. Rice.
Yeah, shout out to Dr. Rice for sure. He's definitely helped me a lot. I mean, I'm still learning like a lot about the financials as well. So yeah, like just keep learning, like reading books. You can like, it makes sense to me now how some dentists are just like they just work at a DSO and do dentistry, and others really take to the next level and try to own multiple practices, because there is a lot to learn to get to that.
Right.
For sure.
Well, we definitely appreciate your time, Dia. If you have any other questions, feel free to feel free to ask if there are any other submissions in the chat. If not, we can go ahead and wrap up today's session.
Awesome.
Yeah, well, we have one last question. I think you kind of went over this. Any DAT tips other than PAT?
Yeah, I would just say use like multiple different testing prep materials from different companies. It really depends too, like on your college. Like I remember I took one class at one college and one class at another. My college like prepared me for very well, so I didn't really have to study for some sections. They're not the bio. I remember now I think about the bio was a bunch of random stuff that I never learned in college, so I just had to memorize that. Yeah, just practice questions. They're pretty similar to the test from what I remember.
Yeah, I think that's a good point. There are a lot of incredible resources out there for students. So I think we would all encourage, students to find a service that aligns with your learning style and your learning needs.
Yeah, I think I did like a Kaplan course because I knew I'd struggle with studying myself. So you could do that, but you also could just easily, if you're very motivated, could do it by yourself and map out a schedule. I don't know if anyone has any schedules that are well known on the internet, but I'd recommend that probably.
I think specifically a resource could be bootcamp. I know they have a schedule.
Oh, cool.
Yeah. I don't know if you're familiar with bootcamp?
Yeah.
A lot of my peers right now are using that.
No, I didn't. Yeah, I only did the Kaplan thing. I wish I did others. I would have done that.
So I'll write that in the chat. Kaplan and bootcamp.
So like there's definitely so many resources. So check them all out.
Yeah, do your research. There are also a number of different study groups on Facebook, on different social media platforms. So it's always good to engage and learn from other students. So definitely interact and do your research. But if there are no more questions, we can go ahead and conclude today's session. Dia, how's the chat looking?
Yeah, it's good.
Awesome.
Yeah.
All right. Well, on that note, we can go ahead and wrap things up. Dr. Shapiro, thank you so much for taking the time out of your busy schedule to connect with us. We wish you a productive year.
Awesome. Thank you guys.